We have 555 students, more or less, and 85 staff. And within those numbers, nearly 25% of our students were absent, the majority of them with flu-like, cold-like symptoms. As superintendent, it's knowing that we have that many children getting sick, and staff as well. And seeing on the news and other outlets how strong and contagious this flu strand is, I just couldn't have kids come into school or staff knowing that they're continuously getting sick and we're continuously sending them home. Part of being closed for the rest of the week is not just to clean the building, but it's also just to let our children get healthy again, so that when they do come back, they're feeling better and they're not bringing in anything that might be contagious still.
This particular strain of flu, the H3N2, is more dangerous for children and adults. It just happens to be more virulent. We see more illnesses, more complications, more deaths due to this strain of influenza. Symptoms that one wants to be aware of in children and adults will be difficulty breathing, shortness of breath, chest pain, could even be nausea and vomiting, fever that won't go away. And really, I think one should have a low threshold for contacting their healthcare provider to determine whether they need to come in and be seen and treated. The best way to protect oneself and to protect one's children is to get vaccinated. And if one hasn't been vaccinated this season, it's not too late to get vaccinated. If an adult is sick, then they should try to stay as much as possible away from others who are not sick. Covering one's cough, cleaning one's hands frequently, and cleaning one's environment using household cleaners and EPA registered disinfectants that have a flu label on them is important. Staying away from work, staying away from school, and trying to protect others as well as oneself.